It's been 7 weeks, one day since surgery, and just got back from the doctor for my checkup so they can see everything down there and see how it's healing and whatnot. And have good news. She cleared me to do regular, normal day-to-day stuff. I just have to slowly add things back in because of down there's still healing, so some things I may not be able to do, some things I'll be able to do, like suggested not running, stuff like that. What's going on? I have one spot at the top of the incision where the scar line is, the very, very top on the right side. She was saying it's because I've been having issues with it bleeding. She's saying it's a scar abscess because that spot they have to put more stitches, and she wants me to keep massaging those areas, and she's saying that it's a stitch abscess where the stitches can end up poking through. And she's saying that because she cleaned it off with an alcohol wipe. Because she's saying when she does that, you can tell if it's sticking out or not, like the stitches, because the way it sounds. So she's saying that they can remove the stitches if there's any, or if I notice it, then use tweezers to pull it out and snip it off. But we didn't find any stitches, so yeah. So just have to keep an eye on that, because if it gets worse, then you let them know. And she's saying, because I'm 7 weeks out from surgery, how everything looks, it looks really good. But because I'm having a little bit of bleeding vaginally still, she's saying to use this one to keep using. She cleared me to stop using the medicated stuff and go straight to water-based lubricant, but because I'm having that bleeding, she wants me to continue using this one, only this one, not the other one with the lubrication and whatnot, the water-based lubricant for the dilation of that, for that lubrication and all that. So until the bleeding stops, like for a couple of weeks, or until the bleeding stops. So I just have to check, make sure if it's bleeding or not, to continue using this one. And if it's not bleeding, then I don't need it anymore. So yeah. And she was saying that I'm cleared, like sexual wise, hands, like my fingers and whatnot, oral, but she doesn't want me to do thrusting vaginally, but fingers are okay. She wants me to wait until it's more fully healed at the 3-month mark, which I've done one toy thrusting. I didn't mention it at my appointment, but I did do it. So I can't do it again until 3 months. So, which is kind of frustrating, but good. And she asked if I orgasmed or tried orgasming since my last appointment with her, and I did a bunch of times. Still having spontaneous orgasms, and the non-spontaneous was just experimenting. I've done clitoral stimulation a bunch of times until I actually climaxed and came, right? And the best way I can describe is describe it how it feels. I orgasm multiple times. When I say multiple, that means more than 2, more than 3 or 4. Because I'm able to orgasm a lot. Then the best way I can describe climaxing now compared to before, because before, when everything's connected together with the urethra and all, like when you come, then how I mentioned in the past video, being on hormones, like the HRT just oozes out over it, like the tip. But since surgery, when climaxing, I feel it in the clitoris when I climax, but when I come, the way those fluids are, it, instead of before, how it just oozes like a volcano over the tip or of it, and now where the urethra, because on my body, it's like the clitoris is like here, then the urethra is like really close to it. And studies have shown the position of the urethra to the clitoris is what makes it more functional. As I was saying, when you come, those ejaculate fluids, when it comes out, because where the urethra is and everything, from my experience, it comes out like quickly, but doesn't spray out, just comes out and coats everything. And it seems like it's a lot thicker than before, and it's much more clear. It's like clear. And yes, if you're wondering, I did taste it. Didn't really have a taste to it compared to before surgery. So yeah. And when climax, the best way I can describe the feeling is that feeling when like a body part goes numb, then it comes out of that numbness, that like kind of like vibrating feeling. That's not painful. It's more that vibrating, like flowy kind of feeling, but right. dead center of the whole vulva. And it actually feels better now than before surgery. So yeah. And when I did use my toy, that was the last time I did thrusting I'm not supposed to be doing when I did it with that toy. But when I did that, I was able to squirt, finding where the G-spot is and all that. So that happened, which made me, it's like the mind-body connection was more connected. And from before surgery, that would help with my dysphoria. And now it just feels right and normal. And not having any dysphoria, and it just helps it even more so. And yeah, so I was able to come, climax, squirt. So yeah, but I've noticed that penetration with the G-spot, same thing as the prostate. That's the only stimulation I've found that, if done long enough, I'm able to squirt. And if I just do clitoral only, I'm able to come. It's like I'm able to, orgasm multiple times. And when I climax, I end up coming. Then vaginally, that G-spot stimulation, I'm able to orgasm multiple times as well. And squirt, but when I squirt, I don't have the feeling of climax, so I could keep going and going. So yeah. Other than that, let's see here. I've had oral done on me once. That was an experience that was worth every second from the beginning until minutes afterwards. All I can say is it felt normal, felt right, had a really big mind-body connection with it. I was able to orgasm multiple times. I mean, more than 20. I'm not going to say the exact number, but it was more than 20. Less than 30. And the last orgasm from that was the biggest I've ever had. And since being on hormones, from what I've mentioned in a past video, being on hormones is like sexually, I found out, especially on progesterone, when it makes everything more sensitive. I found out I'm a screamer. Too much information if you didn't want to know, but yeah, which was really difficult. Not screaming, but yeah, but that was the biggest orgasm I've ever had. And when I'm able to do more, I'm not quite sure how it's going to be. So I'll know in about a week and a month. Yeah, so 5 weeks would be. I have to wait a whole 5 weeks before I can do certain things down there sexually, but what I can do is what I can, which I've noticed it's been helping with the spontaneous orgasms to be less. So the issue I'm having with the spontaneous orgasms, relieving it when I feel. I just wish I could do the penetrative thrusting against the G-spot, because that helps a lot. But I have to do what I can, like with the healing and whatnot. So, but it has helped reduce the amount of spontaneous orgasms I've been having, and been really happy with it and how things are going. I'm just not quite 100% where I would like to be healing wise, because the issues, the spots I keep having that's bleeding, I wish it would heal already, not create that abscess and bleed from breaking open when massaging. So they want me to continue massaging those areas to help with the healing. So yeah, which I've been doing every single day, every morning in the bath or shower. So and my drainage, vaginal drainage from everything healing is getting less. The color is still that, so like that light yellow, but less yellow in it. But it's not clear. So still having a little bit of drainage. So that's still happening. I'm hoping with not using the other medicated stuff for dilating, the one I don't have to use anymore, not using that one, the drainage will be a little bit better, because the other one I'm supposed to use in the morning. Well, I was instructed to use in the morning, flush off the skin and leave internally, leave in, but not having to use that one, realize drainage of that coming out. So, and it would just be the water-based lubricant, which depending on what kind you get, especially if it's more towards like the natural vaginal fluids, your body can absorb it. So there'll be, like, in a healthy way, where it's not bad for you to leave in. So there wouldn't be drainage from that. So yeah, we'll just have to see how things go. Other than that, the one thing I've been noticing since the electrolysis I've had, how I mentioned in a previous video that I've had regrowth and I wasn't able to get in before my surgery to have any touch-ups done. So the only regrowth with having the surgery, only regrowth is the upper part of the clitoral hood. It's how some people's extend up higher. It's the upper part where it extends a little bit higher, where I had a regrowth before, but where the regrowth was on everything else, scrotal tissue, that hair is completely gone since surgery. I'm not sure what they did to get rid of that hair, but that hair is completely gone, which I'm thankful for that. So what the hair that is left, I don't necessarily have to have it removed, but like cosmetically, more cosmetic and how I just feel with the look, to not have it on that part of the clitoral hood would be nice. So that's the only spot I need touched up down there that I've noticed. But other than that, I just have to wait and see how things heal. And the other thing is with the hair, you can actually see the shape of the hairline from before when it was removed. And yeah, you can still see that rounded shape. So it's just the hair that's in between that's come back. So yeah, other than that, don't have any other hair down there that needs to be removed. Even though I have less hair on the labia majora than what most people would have. There's still enough hair to cover, so that's still good. And no other hair I've noticed. It's just since surgery, the body hair is just growing a little bit slower, I've been noticing. Not necessarily hair has gone away, but it's more softer and finer and a little bit thinner on my legs. So yeah, it's a lot softer, finer, and thinner hairs on my body. So I don't think the rest of my leg hair is gonna go away at this point. But all I can do is see based on hormones, not having that high testosterone anymore being produced. And next month will be my doctor's appointment with the doctor who's prescribing my hormones to get my hormone levels checked and a post-op check on everything to make sure everything's healing right and regrowth of hair and whatnot. So yeah, other than that, I'm still very, very happy, even though my emotions are still doing those weird things it does, where it drops off, or I feel like crying at times. And yeah, the big thing, a very big thing I've noticed too. It's more recent since surgery, I've been a lot happier, a lot more comfortable with my body naked. I'm not having that dysphoria of down there naked, being unclothed. I'm more comfortable with it and the way it feels, especially sitting down. Just the normal day-to-day, just sitting. It just feels right and normal. And naked, it feels even better. It just feels right and normal. It's like at my appointment when I had to strip the bottom part down so they can do the exam. Just sitting there waiting for her to come in and do the exam. It felt right. And it felt normal. It didn't feel weird or awkward or things misplaced or things that's not normal. It felt normal. It felt right with all the feelings and sensations. I don't know how to explain how that feels that way. Just feels right and normal. There's no words that come to mind how that feeling is when being naked and sitting down where the vulva is, having that pressure against it, just normally sitting naked, and all I can say is it feels right and normal. Clothing wise, it feels normal as well. It's just, I've noticed since surgery, it's like over time, from surgery to now, the pressure against the clitoris, the clitoral hood, how that was very uncomfortable at first, and slowly it's become more and more comfortable, especially stimulating the body, letting you know it's okay to be touched and whatnot. It's helped. So it's less uncomfortable unless it becomes sexually swelled. Then it can be uncomfortable with clothing rubbing against it. But when it's not sexually swelled up in its normal state, it's comfortable now. Not like 100%, because it's still healing and having nerves reconnecting, because I've been having lots of nerves reconnecting in the bottom part of the clitoris, like where the next to the clitoris and urethra, or that in between spot where it connects. Yeah, that's where I've been having a lot of nerves reconnect, and part of the clitoral hood, which the more nerves that reconnect in the clitoris, the better it will be in the long run, especially sexual wise and the normal function of it. So, which the nerves reconnect, it's very uncomfortable until the feeling subsides. Then after that, just sexually it feels even better. So, and in the previous video, how I mentioned before surgery, it's like if it feels like what it feels like before surgery, everything sexually done in the female way, the best as possible, with having it structured the other way, how it felt doing it that way compared to now. I was like, it feels like G-spot stimulation, for instance, before surgery. It's like, it feels this good now. How does it feel after surgery. And after surgery, when I did that, it felt even better because it was vaginal penetration instead of the other way, and it just felt normal and right. So yeah, well, other than that, it's fully functional. I just haven't been able to tell you if my body's actually creating vaginal fluids or not, like the natural vaginal fluids that the vaginal canal creates, that's self-cleaning, or more importantly, like sexual fluids that create for lubricating for sex. I don't know if my body's able to produce that or not yet. There's a few times I've kind of couldn't tell if it was that or drainage with all the spontaneous orgasms, how that stimulates down there. Yeah. So I just have to continue to explore and see how it is, if I'm producing it or not. Because I know that can happen. And there's lots of trans women who's experienced vaginal fluids post-op. So, yeah, other than that, the vaginal canal is still healing. I don't feel any stitches in there anymore. And there's just one spot that's kind of weird how it's shaped in there. It's kind of like you have the canal, then it has this lump that's kind of folded weird. That's still the swelling on that spot still going down, but kind of like it's a weird feeling. But that spot is where my G spot is, apparently, from what I figured out by exploring. And my tip, which I have been following my own tip here, before you use your fingers in vaginally fingering, make sure your fingernails are trimmed so you don't accidentally scrape or cut or poke something and cause it to bleed and cause sores, because that can happen because the vaginal wall can be thin. So to prevent that damage in there, have your nails cut and your fingers and your hands clean to prevent bacteria and other things from getting in there and causing all the wonderful bad stuff that can happen. So that's a tip. And tip number 2, even with massaging around the clitoral area and the urethra, where that part has to be massaged, or any kind of sexual activity, I say pee afterwards, just to make sure that the urethra is being flushed out, so nothing gets into the bladder or urethra to cause urinary tract infection. Just proper cleanliness. Just remember, it's my tip. That's proper cleanliness, sexual cleanliness. That's like one of the biggest ones, is pee afterwards. From my experience and from everything I've learned, that's the number one. That's in the top 2 of proper sexual cleanliness. So pee afterwards, and that can help. So, and drink plenty of water. That's another big tip, because the more water you have in your system hydrates everything, and when everything's hydrated, it helps it to heal quicker. And when it's not hydrated, it's like the skin's deflated. Then when you do become hydrated, when it hydrates the skin and fills it up, that can actually make it a little more uncomfortable as it's healing, especially when nerves are reconnecting and all that, from my experience. So that's my tip, my two big tips, or couple of tips. Yeah. And that's pretty much what's happened since my last video on how everything's going since surgery. And if you have any questions, because I've noticed people aren't really asking any questions, like in the comments section below this video. So please, if you have any questions, things I haven't answered, or if you've seen other people's videos and I've never mentioned something that was in their video, or something that's, or how other people mention certain things and I've mentioned certain things, I just want to just help others understand what actually happens and what's going on with everything post-op, from my experience, how things are healing, what happens sexually and non-sexually, and how some people don't do post-op videos and some do that don't have a lot of information in it. If there's things you're wondering from others' videos or from my videos when you're watching this, please just ask, and I will do my best to answer. So, until my next video, please comment, rate, and subscribe. And one last thing I've noticed since surgery, my face is more feminine looking. So, please comment, rate, and subscribe. And till my next video. Boo!